Hello, everyone. It's Dr. Maria Ryan, Chief Clinical Officer at the Colgate-Palmolive Company, and I'm really happy to welcome you to our third episode of our LinkedIn series, Get to Know Your OQ with Colgate-Palmolive. And we have a very special guest for today, Dr. Marko Vujicic of the ADA, and this month, June, is ADA's Oral Health Month, so it's really appropriate that we have Dr. Vujicic here with us today. And I want to take a few minutes to just introduce Marko, who currently serves as the Chief Economist and Vice President of the Health Policy Institute at the American Dental Association. Previously, he was Senior Economist with the World Bank in Washington, D.C., where he focused on health systems reform in developing countries and directed the Global Health Workforce Policy Program. He was also a health economist with the World Health Organization in Geneva, Switzerland. In all of these roles, Dr. Vujicic led large-scale strategic initiatives focused on bringing cutting-edge data and research to specific health policy challenges. Dr. Vujicic has published extensively in peer-reviewed journals and is the lead author of the book, Working in Health. His team's work has been cited by multiple media outlets, and he has been invited to provide testimony to federal and state legislative committees. And I have to say personally, I have enjoyed working with Marko on a number of different things, including we had a congressional briefing a while back where we sat on a panel with Dr. Martha Summerman, who at that time was the director of DCR, and Marko said at that time that in order for all of us to make progress in bringing oral health to the forefront, we need to break down silos and work together, whether we're in industry or whether we're at the ADA or whether we're in government or in academia. And so it's really a pleasure for me to have you here, Marko, because this program is partially because of, the work that we've done together and the comments that you've made, which make me realize how important it is for all of us to work together.
Maria, it's always a pleasure to sit and spend time with you. Thanks for the gracious introduction, and congratulations on the launch of the Know Your OQ.
Oh, thank you so much, Marko. And, it's an interesting time for us. We're seeing a lot of movement finally in oral health, and I think in a very positive direction, with people really understanding the importance of oral health to their overall health and well-being. And many of us have been involved in studies over the years looking at the impact of periodontal disease on other chronic conditions like diabetes. And certainly, I think a number of insurance companies have done quite a bit of work looking at the impact of improved oral health on decreasing costs, medical costs and hospitalizations. And I think that has been really important to us as clinicians, to our patients that we treat. And I think now consumers through Know Your OQ are starting to learn more about the importance of oral health to their overall health. And I know you have a lot of data that you have collected in this area. And I'm curious as to your feelings about what's happening when we look at the connections between oral health and overall health.
Yeah, so Maria, as everybody listening in knows, our mouth is connected to our body. But sometimes out in the healthcare world, it may not feel that way in terms of the way the system's organized. But I think one of the things that's been exciting for people like me that are wonky researchers and data people is we have seen a big growth in the evidence base, linking conditions in the mouth with rest of the body. So in a nutshell, we now have pretty good evidence that when you invest in the mouth, you get ROI in other parts of the body. So gum disease is linked with, and it's an association. We don't know which way it all goes, but for economists, frankly, it doesn't really matter. We know that the more you spend on improving oral health, you do get savings. One of the studies we did was if diabetics had routine dental care, on average, they'd save about $1,400 per a 2-year period in healthcare costs. In the US, we spend about $2 billion per year on emergency room visits for dental conditions. So there's lots of sources of medical care cost savings if we invest in the mouth. And that's exciting. That research is growing every day. And it's really, I think the last 5 years, I would say we've seen a lot more there. Kind of for the economists who are saying, okay, how much does this cost? What's the benefits, et cetera? We now have a lot better data on that.
Yeah, I think the data is really interesting, and of course we've always, been concerned about our appearance and a bright smile, but clearly, the data shows that your oral health really can have an impact on your overall health, and it's really important to manage it. And I've always said, it's essential, and I think the pandemic was a time where we really learned how essential oral health is. And when the pandemic first hit, I remember the announcements on TV where they said they were going to close dental offices because, it was non-essential. And I thought, have these people never had a toothache? And have they never been in an emergency room? Having worked myself in various emergency rooms during my career, some are not very well equipped to manage oral problems. And so I thought, what's going to happen here? And clearly what happened was people did start showing up in emergency rooms when, the healthcare providers were trying to save people during a pandemic with COVID, and you have people with a toothache with nowhere to go. And very quickly they opened up the dental offices, but really proving how essential oral health is for the population. And so I know that the HPI has done a lot of work during the pandemic to look at trends and things that have happened within our profession during the pandemic. And I would love for you to share some of that with the people listening.
Yeah, and Maria, and I know we'll talk a bit more about essentialism and what that exactly means, but I love the way you framed this, right? So this last 2+ years really has for dentistry been an interesting experiment's probably not the right word, right? But it's a real never before seen type of shock that has shown that, this is not a service that should be shut down. And it is, dental care is core primary health care and is essential. But what I wanted to raise, and we had talked about this, I think more interestingly, we really saw the pandemic be almost like the mouth could be used as a barometer of people's stress. So what we saw in our data was that period when the pandemic was hitting and offices were closed, dental offices, and then reopened, we saw an influx of people that were grinding their teeth. They had chipped or cracked teeth. They were stressed. So it was almost like you can see people's stress levels by looking at their mouth, which again underscores what we just talked about that link with the mouth and the body. The good news, though, is we have, in my view, demonstrated how resilient this sector is and how confident the public is in terms of visiting their dental team and their dental care providers. We have not seen at all any sort of increase in hesitancy to visit the dentist. As you know, the ADA worked hard with the CDC to put enhanced safety guidelines in to kind of prevent transmission, and that really has worked. We've really seen, frankly, close to 100% rebound in patient volume. So I think, it's kind of a good news, bad news situation. The good news is we clearly see the public viewing this as really important. And that partly feeds into your Know Your OQ initiative. But we do still, I feel, have some work to do with making sure dentistry stays essential. And we can talk about that a bit.
Yeah, absolutely. And to that point, we had the recent report come out on oral health in America, which is 20 years after the first report written by David Satcher, the Surgeon General, on oral health in America, and this one released through the National Institutes of Health, and Dr. Rena D'Souza was one of our first guests on this program. And we talked about, how little progress, unfortunately, we have made over 20 years. And certainly, I think the World Health Organization, which you worked with for part of your career, and the World Health Assembly resolution really brings to the forefront the fact that, caries is one of the most common diseases in the world in children, and that periodontal disease is the most common chronic inflammatory condition in the world. And about 50% of the population worldwide is suffering from oral health diseases like caries and periodontal disease. And, based on all that we see happening, there are efforts to, have policies put in place to educate people about the importance of oral health and bring in other healthcare providers. And I was just wondering, what are your thoughts on this? Because a lot of good things are happening, but perhaps we're not moving ahead as quickly as we could or should.
Essentially, we are at, in my view, a turning point where we have a significant amount of momentum, trying to see if dentistry can truly be incorporated into broader healthcare policies. That's what you mentioned about the World Health Assembly. So I feel, definitely the world is moving in that direction through WHO and those types of initiatives. But I feel here we still have some work to do in the US. And again, there's lots of policy debate about things like, should dentistry have been part of the Affordable Care Act, or should it be included as part of Medicare and things like this. Those debates are going to continue and intensify. But Maria, I think we had talked about this a lot. I think if we truly believe oral health is connected to broader health and the mouth is connected to the body, then I think the way we're designing our dental care system now needs some reform. And that's something we look forward to continuing to research in the coming years.
Yeah, and I'm a very proud member of the ADA my entire career, and I had a wonderful practice in periodontics for 20 years. But I'm always shocked to hear that in our country, only about 50% of the population actually ever gets to the dentist. And I really think that, through programs like Know Your OQ, helping to direct people, helping to inform them about the importance of oral health and the need to actually see a dentist before things get so bad, I think is something that we need to really think about. And I don't know how we can reach out to the other 50% in our country. And just as a part of this discussion during Oral Health Month, it's so important for people to realize that they do need to see their dentist.
So it's great you raised this. So I think initiatives like Colgate is doing, like Get to Know Your OQ, is right on point. And I really applaud you for launching that. It's really important to have the consumer perspective and patient perspective and how they perceive their oral health, and not just looking at it from clinicians giving advice, right? There needs to be a complementary thing. At the same time, Maria, the evidence is pretty strong that the reason people who don't go to the dentist is due to financial reasons. And a lot of that has to do with how we've designed dental insurance, in the sense that it's not true insurance like medical coverage is. A significant share of the population doesn't have it. Children do. Over 90% of kids are covered by some type of dental coverage. For seniors, it's around 30 to 40, depending on the data, percent. So there's significant gaps there. And I think what you've highlighted and the work you've done too, through different forums, Maria, is I think we need to start re-examining whether we want to expand coverage for dental care and reduce those cost barriers, and more importantly, improve the payment model, improve the coverage model, because I think we can do much better. So that's from a 30,000 foot policy level. something I really feel we need to start looking at.
Yeah. And having worked at a dental school for over 20 years, we were the safety net. And so, through Know Your OQ, we talk about going to find a dentist at the ADA. You have a list of members like myself where people can find a dentist, but we also talk about the DSOs and how people can find a dentist through a DSO or an FQHC or at a dental school. Where, so there are various opportunities for people to reach out to the dental profession. And we hope to expand that so that 100% of our people actually get to a dentist rather than 50%. So I think this has been really a great conversation, Marko. And I would like to end it with some calls to action. I always like to end it with what could people do right now? So what are 3 things that you think that our listeners could do right now to improve their oral health and to support the work that you're doing at the Health Policy Institute?
Sure. I would say 2 are probably directly in the hands of patients and consumers. One is, do the prevention that we know works and is evidence-based. So wellness routines, brushing, flossing, rinsing, things like this. Really, really important. Diet, low sugar diet, etc. Take prevention in your own hands. Second is regularly visit a dental care provider, right? We know from the evidence that that's an important step. And on both of those areas, people can go to ada.org and there's tons of information about both finding a provider, and there are different ways if you don't have insurance that you can select. And if you do, you can see who's in your plan, etc. As well as all the prevention information. The third one is a little bit more, maybe not to the average person on the street, let's say, but it's more to our legislators and partners and the ADA and other groups like Colgate that are working on this kind of at the 30,000 foot level, is to really kind of walk the talk on essentialism. I really feel that we're at a point where the evidence is building and the public sentiment is growing on dentistry really being important. But with that comes, I think, a re-examining, let's say, of, frankly, the silo that dentistry is in terms of delivery and payment models. So, and again, I'm not saying do this, do that, but I think we need to discuss it and have a debate and figure out, do we truly want to incorporate the mouth into primary care going forward? But that'll be a discussion for months and years to come, and look forward to continuing on that one, Maria.
Thank you so much, Marko. And I'm in complete agreement. It is really part of our overall health and should be considered essential to it. So however we get there, we shall find out. We're all on this journey together, but it's so important that we've gotten to that point where people do recognize how essential your oral health is. So I'm happy that we're here celebrating Oral Health Month with the ADA, and thank you so much for joining us today.
Thank you for having me, Maria.